Good afternoon, everyone. I'd like to start by acknowledging the Ngambri peoples, who are the traditional custodians of the land on which we're meeting today, and pay respect to elders past, present, and future. In the room today, you have Laura over there, Director of Communications and Partnerships at the National Cancer Screening Programs of the Department of Health and Aged Care, Charles from research agency Whereto, and myself, Rob Tolan, Director of Campaigns and Communications at Cancer Council Australia. Today we're here to talk to you about Australia's deadliest obsession, or one of Australia's deadliest obsessions, and our journey to end that deadly trend. So we're talking about Australia's most common cancer, about breaking new ground in government and public health communications, and about taking and managing risk to ensure communications are effective in driving behaviour change. So as we know, next one. Oh yeah, you're right. As we know, Australian has a very deadly sun. Almost 2 in 3 Australians will develop skin cancer in their lifetime, and melanoma is the most commonly diagnosed cancer for those aged 20 to 39. Sadly, skin cancer takes the lives of more than 2,000 Australians per year and costs the Australian health system more than $1.72 billion. Still me? No, it's you.
And yet we know, and anyone who's been a young Australian, yes, knows just how much we believe that a suntan makes us look good. But even more than this, we believe that a suntan is a sign of good health. It's a life well spent in the outdoors, the influence of that cultural influence is just massive and pervasive. So thinking about that prevalence stat that Rob mentioned, 2 in 3 of us will get skin cancer at some time in our country, the social and health burden of that cultural phenomenon is just enormous. So ahead of undertaking what would be the first national skin cancer prevention campaign targeting young Australians in over a decade, we undertook extensive formative research confirming the hypothesis that Australians have unhealthy attitudes towards suntanning and that intervention was needed to disrupt these attitudes. In our focus groups, young Australians talked about the strong influence that social media has on their worldview and how the unfiltered perspectives of these influencers were trusted, things that they really follow, and they filter out mainstream advertising and voices. Attractive influencers shape what's hot and what's not, and that means that Australia's deadly suntanning culture is supercharged by the tan lines that are proudly showed off on TikTok and Instagram. When we ran the numbers, our modelling showed that this was very definitely the case. Bad social norms, the influence of social media and on sun protection behaviours was one of the strongest drivers of unhelpful attitudes. You can see there the bad social norms at the top there drives unhelpful attitudes, and that's what they both have a negative influence on adoption of sun protection behaviours. So it showed us here that the usual approach for skin cancer prevention campaigns of targeting behaviour change alone was unlikely to shift behaviours amongst our audience long term due to that prevalence of social norms and appearance-related attitudes. So you can see outlined in this behaviour change model, which was used as a foundational model for understanding how the campaign would work, that there's 2 primary drivers: the unhelpful attitudes, the misinformed behavioural beliefs. That's this top layer. And the smaller red and green numbers in each of the boxes are the total standardised effects. If you know structural equation modelling, that's sort of the simplest way to understand the effect of each one of those factors. And so we know that unhelpful attitudes there, preventing uptake of healthy behaviours amongst almost 4 times as many, operates at a level almost 4 times as strong as the misinformed beliefs there. The unhelpful attitudes was the most problematic things were things like clothing looks better on me when I have a suntan. I feel more healthy with a suntan. I look sick when I don't have a suntan, and I look slimmer with a suntan. So you can see that very strong attitudinal belief is the thing that prevents people from engaging with sun protection behaviours. So we can also see there very clearly the culprit for those unhelpful attitudes. It's all bad social norms, and the research showed us was mostly showing up in social media. So using a variety of questions covering the gender, age, intention to suntan, beauty standards, attitudes to sunburn and sun protection behaviours, we conducted a latent class segmentation, and that revealed 5 segments there. You can see we had the sun worshippers, who were mostly young women, who know the risks. We all know the risks. That's the problem. We all know the risks and the behaviours we have to take, and that's what makes this challenge so hard. But they engage in suntanning because they know they're more attractive when they're suntanned. We have the cautious tanners there who represent 19% of young adults aged 18 to 30, and they acknowledge that a suntan looks good, but they're very careful about how they do that, and they're more willing to wear fake tan, for example, to get the look they want. The carefree and careless, mostly young men, not probably surprising, they've got very risky attitudes towards tanning. They don't really care. They don't really worry about getting burnt here and there. They just want to hang out with and impress their mates. Then we've got the covered up, which were mostly men, but they are very pale men who burn very easily, and so they are very careful and watch out for their sun protection behaviours. And we've got that ambivalent avoiders, again, who are mostly men, but mostly also indifferent about their appearance. So we know from the broader evidence base around behaviour change and communications that to really deliver behaviour change, the communications need to hit people from every direction. They need to come from multiple voices. They need to be saying multiple messages and multiple channels. It really requires that 360-degree surround sound effect for any kind of behaviour change to happen from mere comms, right? You've got a bunch of different ways you can affect people. Comms is one, and it needs to really happen in this way to be effective. So we also then chatted with some of the big kind of commercial influencers, the beauty industry people, and they told us that in commercial environments, what influencers, social media influencers drive sales. They simply, if you want to sell a new makeup, you put it in the hands of a beauty influencer, she'll do an unboxing, and suddenly you'll have 1,000 sales the next day. So we know it works in the commercial environment. It's much harder to measure in social marketing features. So but then we went on and ran a group with influencers. We got the most beautiful looking group of people I've ever seen together in one online focus group and chatted to them about how they work and how they operate. And they told us that their audiences crave authentic engagement and not scripted messages. So you can't tell them exactly what to say, it just won't work. They know their audiences better than anyone else, and therefore they know what messages will work. And they need to have really full creative control, and it just doesn't work if they merely parrot the lines that they're given by a sponsor. So they also emphasise to us what it takes to cut through with young adult audiences, gain traction, and gain the views that are the currency of the internet. And that in itself is probably the biggest tension for risk-averse government communicators and those on the side of all progressive issues, because you must have a hot take and something interesting to say, which means you've got to generate controversy, and you must not be boring. So knowing that young Australians aren't consuming media in the same way as other cohorts, and that instead of a traditional media approach where they turn on the TV and access their news or consume that content, they're curating their own sources of influence and trust, predominantly on social media, we knew that we needed to leverage this. Social media is where they take and seek advice, and it's where they develop attitudes around social norms. So this research showed that it was seen as an influential and meaningful source of health and beauty information. Given social media is where our audience seeks information and forms their attitudes, we determined that using third-party voices on our audience would know and trust to share campaign messages instead of sharing directly from Cancer Council or the government would be necessary to drive lasting change.
So yeah, influencers were specifically identified as a key driver of norms and attitudes in the research, and the research also found that influencers were reinforcing the idea that suntanning is attractive. This was in addition to insights around fashion as a sector, driving bare-skinned looks. So in combination, the research really painted a picture overall of a culture that was working against good sun protection behaviours. For the most high-risk audience segments, so those sun worshippers and cautious tanners, this was especially evident. Sun worshippers being highly motivated by the perceptions of others, including social norms, really influenced by celebrities, influencers, brands that resonate in this space, and cautious tanners who are also heavily influenced by social norms, despite being well informed about the threat of UV exposure and making a more conscious choice to avoid sun damage. Further to all of this, we know that brands and broader influences in the industry, such as beauty and fashion, perpetuate the issue. So we see visible town lines, for example, in fashion campaigns, and tips on maintaining a bronzed glow in summer in lots of media. The brands our audience know and love were really perpetuating the problem and the expectation that a suntan is desirable for young people.
So the concept of using influencers, it's not particularly new and it's not particularly innovative in a general sense, but it is for government. So traditional media for government, it's a really safe space where an ad can be made, tested, vetted, it's booked, it's exactly as it was approved, and it's a clear process with really obvious controls. But as we know, young people aren't on traditional media. So it was really clear to us that we needed to go into the uncharted for government, waters of influencers to achieve our objective. And for the department working in early 2024, no authorised government campaign had yet done this. The vaping campaign with young people was yet to come. So working with influencers was really only possible for us due to our partnership with the Cancer Council. It allowed us to take on the risk of engaging with influencers through that third party with additional layers to help us manage the risk. So the first hurdles for us were onboarding stakeholders to the general concept of using influencers and the risks associated with that, and setting parameters around identifying and briefing our potential influencers. We needed to identify the right kinds of influencers that would not only resonate with the audiences that we needed to reach, but those who we could actually trust to carry this important message. So we eventually identified more than 120 of them, but they were exhaustively vetted, and that whittled the numbers by more than 50%. We needed to be sure that the influencers had what we would call clean profiles. So smoking, vaping, drinking, drugs, they're obviously out. But it was a little bit more nuanced than that. We also needed to make sure that they weren't promoting generally unsafe or unhealthy lifestyles, because a failure in our due diligence at this stage could undermine the whole campaign, or the government or the Cancer Council's integrity in driving an important health message. So the influencers were provided with the do's and the don'ts, a series of guidelines as part of their brief, and then they were allowed to develop their own content around agreed messaging. But it was really important to us that they were authentic and true to their voice and style. So this approach, it did not allow for tight control. We had to really trust in that vetting process and the agreements we made with the influencers. We did retain final approval, but as you can understand, some drafts really needed to be reshot, but it was clear in a good way that most creators were really enthusiastic about getting these details right. This really mattered to them. So showing broad-brimmed hats, they were really amazingly creative about making sun-safe fashion fun and stylish. So many of our results exceeded our expectations, and the effort was absolutely worth it. But it really took significant thought, time, and people power.
So just moving on to campaign implementation. So knowing that we needed to be thinking as much about the channel as the message, and that we can't rely on traditional advertising with this audience, it was abundantly clear within the formative research, as well as message testing, that without softening the audience with third-party voices to make them feel safe to adopt these new norms, our message would fall on deaf ears. So we began by activating these third-party influencers to position sun safety as more aspirational. Once our target audience was aware of the aspirational alternative, we needed those third-party voices to begin to dismantle those unhealthy attitudes that we saw in that behaviour change model. Finally, only after those two steps had been taken did we introduce the brand play and start the conversation via the creative platform to show how the audience could convert those newly adopted attitudes into behaviour change. So this evolved into a three-phased strategy. The first phase you see here is called Address Culture, which focused on normalising sun protection through pockets of trusted third-party voices. So the very voices that had previously been driving those unhelpful attitudes were now norming sun safety. So we saw posts on Instagram from influencers sporting really fashionable, glamorous sun safety looks, so that it became more of an aspirational look as opposed to what it had been before. We started activating in media, so youth-centric media and fashion media, whereby they would produce articles, organic-looking articles, talking about or kind of positioning sun safety as more cool than it had been before. This then scaled into phase 2, which we called the erode attitudes, and here we became a bit more pointed, but again leveraged those third-party voices who started to directly question the unhelpful attitudes and the culture that was creating this ticking time bomb of skin cancer. Then, and only then, when the target audience attitudes were softened, did the branding advertising get introduced in that third phase, which we called finalised conversion, with the goal to reinforce that the old attitudes weren't worth it and they were becoming increasingly obsolete, as we were seeing through media, brand partnerships and influencers, and it was time to change behaviour.
So our approach followed the 3 phases of the overarching campaign with influencers, followed the 3 phases of the overarching campaign strategy, and it leveraged 3 tiers of influencers to maximise our budget and ensure we're hitting the audience with the most influential messaging across every level of influencer that they followed. So the 60 influencers that I mentioned earlier across the campaign period leveraged social trends like fit checks and get ready with me routines to normalise the use of sun protection behaviours and facilitate conversations with and amongst their audiences about their own unhelpful attitudes towards sun tanning. And it culminated in our branded End the Trend content, so End the Trend of sun tanning. It went through multiple iterations and concept testing. There were a lot of complications here. As with all behaviour change campaigns, there are risks of unintended consequences. So in this case, we found several routes where potential agencies actually served to glorify time in the sun, and the challenge was to make the campaign relatable to young audience and appealing, but also demonstrate the danger and have an effect. So the creative approach was eventually built around a range of scenarios where young Australians are sun tanning, either intentionally or unintentionally, with each seemingly innocent scenario juxtaposed with a sinister twist of a familiar social media hashtag. For example, Suns Out, Guns Out became Suns Out, Cancer's Out, and Making Memories became Making Melanomas. If we have time, we can play the app. We might leave it to the end for now. It launched in late January and took off at scale throughout February and March, calling on young Australians to put behind them the dangerous trend of sun tanning. Due to diffuse media consumption habits, this was a bit tricky. It had to appear across a broad range of channels and formats. So this was quite a complex buy, but anyway, got it done. And finally, the results. So I think this is this gentleman. Yes, I think you were.
So the campaign evaluation was actually conducted by Professor Adrian Borman at the University of Sydney, so independent evaluation. So it's not even our own results we're trumpeting here. But the influencer contact extended awareness of the campaign far beyond what a normal campaign could hope to achieve. So the mainstream campaign, we saw the End the Trend campaign, it achieved a media result and a recall result of around 42%. But when we extended that to including all the influencer content, it actually ended up reaching 90% of young adults aged 18 to 30. So it reached nearly the whole population, which was an incredible result for a social marketing campaign and something that I think I've never seen before in my 2 decades of campaign tracking. So an incredible result in terms of awareness. And 73% of that target audience recalled some form of influencer content, suggesting that strategy to influencers is not only really effective in drawing attention to the campaign messages, but also memorable weeks and even months after exposure. But what we saw, and this is the really important bit, this kind of message coming from those real, authentic and unfiltered voices of social media influencers had a measurable and statistically a significant effect on a range of key attitudes and behaviours. So we saw that 55% of those who recalled seeing both the mainstream and the influencer content components of the campaign said their friends were protecting themselves from the sun more than a year ago, compared to 25% of those who hadn't seen the campaign. 49% of those who'd seen influencer content agreed that social media influencers were rejecting tanning, compared with 17% of those who hadn't seen it, so huge differences there. And then there was a number of other measures. We saw significant shifts at the population level, so not just seen versus not seen, including the proportion who believe that skin cancer is not dangerous, they feel they have a low risk of developing skin cancer, and we saw from that earlier model that that sense of threat is actually critical in driving protection behaviours. They think their friends believe a tan makes them look sportier. They believe it's important to protect themselves from the sun. They believe melanoma doesn't affect young people. They believe that getting a suntan means the skin has been damaged and they can't be bothered to protect themselves from the sun. And all of those things moved in the right direction and at a statistically significant level at that population level. So an outstanding set of results, really, and I don't think I've ever seen anything close to it. So overall, the evidence suggests the campaign was incredibly successful over a very short period, and thanks to the hard work of Laura and Rob in particular, it was only really live for the tail half of summer, so it wasn't even a full season. And so what we found was that despite requiring that more thorough vetting process and rigour when working with influencers, it's well worthwhile to make sure there's no conflicts of interest. We're working with the right partners. That investment can pay off really handsomely. So while organisations like Cancer Council Australia and the Australian Government, who are entrusted with providing evidence-based health information, are highly risk-averse, when the evidence is strong, risky approaches are what's needed, really, to drive successful behaviour change. Thank you.